Welcome to our special eye surgery. We couldn't have the video camera legally inside the surgical room, so we did the next best thing. We took pictures and I tried to explain everything that was happening. The real story of cataract surgery. A lot of misconception here in the Philippines. And the mainland, maybe not so much. It's mostly laser, in and out. But I'll tell you, the most three important things is the doctor, number one, Dr. Martolino. Number two, the lens is very important. And number three is the process, and that you listen to your doctor. And we're going to try to debunk some things that have been maybe misinformed over the years. I was nervous, and so was Shah, but we didn't know exactly what was going to happen. But we assure you, he is the best here, and probably the best in the whole Philippines. You can feel very comfortable with him. And the first thing you do is you go to a follow-up or your first visit, and he checks your eyes, makes sure your pupils are good. He puts these drops and dilates your pupils, so the cataract, the old ones, will get really, really small, so you can see if your pupils are in good shape. And that was kind of a really neat experience, because that's the first time I was able to actually realize that I can see, but it doesn't last very long. The number two thing, to be very careful, and it's a problem because we all have budget issues, but there's different lenses. We'll go through maybe three different ranges. From the low end, 10,000 pesos from Indonesia. It's not very accurate. The doctor would rather not work with that one. The German one is a really good lens. And again, he says they all work fine. But his choice is the American version. It's like the state of the art, the newest, and it's like a fiber. It's like a piece of skin, like your real lens, like God made you in the beginning. And so it's easier for him to work with. It was his exact words. And if it was me, it's very important to have your doctor use a lens that he's comfortable with. I think you would want that if the doctor's working on your eyes, because the lens will last a lifetime. And that one is 26,000 for the American lens. The German is about 20, and then the Indonesia one is about 10,000. So there's a range there. And then you can also save some money by maybe sharing, scheduling. But the main thing is for PhilHealth, if you have it. It depends on what hospital you go to. Some don't take it. You're looking at between 25,000 pesos to 50,000 for everything per eye. And that is pretty much follow through the medicines. And let me tell you, I was just listening to everything that he was saying. I was sitting on the chair in this beautiful operating room, and they were putting blankets or things around me so that I don't get wet from the solution when they clean the eyes. And so it was not walk right in and walk right out, like a lot of people have said. It's like an hour and a half, and you have to pay attention to the doctor. And there was this cleaning solution that he just kept cleaning the eye, which is great. I felt comfortable. And he said, keep your eye on this light. And it didn't look like much of a light, except for it looked like a piece of artwork. It wasn't a round light. Then my first question when it started moving was, do I follow the light, or do I just stay looking where the light was at? And he politely told me to follow the light, which I did. And ironically enough, he said that the women do much better. And I don't know if he was just making me feel good, but he said that I did really well for one of his better male patients. Maybe he says that to everyone. But regardless, it made me feel good. And Shah was outside. She couldn't come in. We had to, really wanted to film it, but that's okay. I will go through step by step. Then they sent Sharon on a gopher run, or to go get all the medicines and the stuff that we need. And when she came back, I may just had 5 more minutes of surgery, and this was probably the most amazing part, is he was putting, first of all, cleaning the lens, listening to the doctor. This weird looking light was all blurry and wet and didn't have very well-defined color. And then when he said he was going to take it out, the lens, or the cataract, which he did, I didn't know much. I couldn't tell too much difference. But then when he said he was going to put the new cataract in, I could not feel it, but I could see something going to my eyes, the best way to describe it. And the first thing I noticed was the fine edges of the light that I was watching. The water, you could see the very fine edges of the water. You definitely could tell that there was a difference. And he asked me, do you see a difference? And I said, yeah, it looks so far really clear. So then we cleaned the eye out some more. Like I said, it's a process. You just want to listen to the doctor. Remember, number 1, you want a good doctor. Number 2, you want to get a good lens. Our suggestion is the American lens at $26,000. If you can't afford that, the German's a good option. Even the one from Indonesia for $10,000. They all will work. But when he had me get up, I had to sit back down because I was finished and he wanted to see how it was working. It was so vivid, so clear that I had to sit back on the wheelchair. I told doctor, can I sit down? He said, sure. It's just like too much in a good way. And he says that happens. And I don't think I've able to see better with my right eye than I ever have in my life. And he said I have 20/20 vision. As you can see, the machine he checked afterwards. And they're really happy. And then I walked around. Finally, they wheeled me out to Shah, and I could see Shah for the first time in a long time. I didn't know what the doctor looked like, and now I saw him and the nurse, and it was just a really wonderful experience that I think everyone must go through. There's this woman that's like 64 that's really sad. There's got to be a way to help her. She has her grandchildren, and she has cataract problems, and all she's got to do is get cataract surgery, and for the next 10 years, she can see her grandchildren, and her quality of her life, her children are everything to her. And there is a thing called GoFundMe pages to help people in the Philippines and other places to raise money for surgeries and stuff like this. I highly look into that. GoFundMe. And it's a very legitimate, been around for a long time. I haven't heard people talking too much about it here, but it will bring you the funds that you need for your cataract surgery. And so that's just about it right there. I went home and there's like a 2 or 3 week resting time. I thought, you could get right back into action, and you got to be careful. There's antibiotics that you're taking, different eye drops, and I don't always do that well with antibiotics, so I was feeling a little bit on the weak side, but nonetheless, I could see great, so I'm not complaining, and I'm getting stronger, and so I really thank God to give me this opportunity and all the people that has helped to help me see, because without seeing, it was really a learning lesson in life. So I'll leave some information, the doctor's name for you to check into, and maybe this will be an option for you if you're in the Philippines. If you're not in the Philippines, well, its laser is probably just another standard way of doing cataract other places. But here I think it's more of a luxury, maybe. Maybe not, but I was happy with the results. And that's what the price range was. So I'll go over it again. Anywhere between $25,000 to $50,000 at the most. A lot of that has to do with the lens, which is the American lens is like $26,000, and then the Indonesia one is about $10,000, and then the German is about $20,000, and then you got the hospital and medicine fees, and then you can do one eye at a time only, and then of course then you got to wait if you need the second eye, which I do, and I'll wait for that. And then I'll have both my eyes. So I just want to thank everyone for being patient. And gosh, I had to wait forever for the lens as well. They had a delay in ordering the lens. A lot of people were waiting. And then this COVID thing came out, and I got my lens in just in time. And I'm so glad, I got tested and everything was good. And I'm happy that I did it when we did. So God bless all. And that's our story, the real story of cataract surgery right here in Kalibo, where you can do it safely and state-of-the-art laser right here. Thank you very much, and I hope this video was informative to the people that are thinking about it. If you're not don't need cataract surgery, you probably won't even listen to it. But you may have a grandma or someone who needs to see, so you might want to listen and give them some advice and help them with their quality of life. So that's about it. Thank you very much, Jay Shaw.
So it's a good thing
Inspiring
that I got
stories. God
my
bless all.
operation.
We love you.